It's various, and it's all about the many different roles that libraries of all types, including public libraries, academic libraries, school libraries. I don't think we have any special libraries, but all libraries of all different types, what they are doing around helping their communities to basically to have better health. So, and working through working with them to improve their health literacy, and then also helping to decrease health disparities in their communities. So like one of the chapters, the authors study food justice. And basically what they study is how libraries, a lot of them, are getting involved in making sure that their communities have sufficient food and healthy food. And so some libraries have actually started like community gardens where people can go and they can either help garden, or they can, you know, pick vegetables, pick fruit. And so they help improve the health of their communities that way.
You had kind of mentioned this before, you know, why it's important, you know, that libraries are helping people right now, especially, you know, to receive the correct information about COVID-19. Can you talk to me about that just a little bit more?
Sure. So the misinformation that's going around has the potential to really impact people's health outcomes, because either if you don't have trustworthy information, or if you have bad information, they're both bad, right? And they're both going to lead to bad health outcomes. And I study an area called health justice, which is basically the conviction and the commitment to making sure that everybody has an equitable and a sufficient capability to be healthy. We can't promise that everybody's going to be 10 units of healthy, right? We're all born with different health possibilities, right? But the idea behind health justice is that we have access to the resources that enable us to be healthy, and one of those resources, of course, is information. And because I'm an information professor, that's the strand that I focus on. And so I look at how different kinds of information related factors, including things like information access or not having access, or trust in information from certain sources versus not from other sources. Basically how those types of information related factors contribute to health justice or health injustice, so to health disparities, and how they impact health outcomes. And my interest in studying this is that I feel like if I can figure out what are these information related factors that are contributing to good or bad health outcomes and health disparities, that we can work backwards and try and shape some of these information factors so that things come out better for everybody. And I think a huge one is information access, and not just access to any old information, but trustworthy information. Relevant information has to be personally relevant to the individual, but it also has to be actionable. So what I'm really hoping is that this highlights the many different ways that libraries are or can, because I also, in the call, we also called for, you know, ideas about future ways, because we want to really expand this function of libraries, but libraries are already doing a lot. And so I want it to be visible what libraries are doing around basically, you know, helping with health justice. You know, in this country, I was shocked when I started learning about this topic that, you know, in this country, people who have higher incomes, who are more, have more education, people who are white, they're living about 10 to 15 years longer on average than people who are not so advantaged in either or all of those categories. And the scary thing is, I mean, that's scary itself, but the really scary thing is that those disparities, those differences are actually increasing. They're getting worse. They're not getting better. And so I actually teach a class on, it's on consumer health information behavior and consumer health information justice. So it's around using information to achieve health justice, to try and, get rid of these health disparities and enable everybody to have the resources that they need to be able to optimize their ability to live a long and healthy life. And so my goals with both the book and the class is to point out that, what is being done around this already, what we can do around it more, and, basically highlighting the need to, put our efforts into this